Hey, it's Tim and the other guy. We're talking today about shoulder impingement syndrome. A new study by BMC Musculoskeletal Disorders said that patients with shoulder impingement benefit from one very simple nerve mobilization exercise. And here's what they did. The practitioner held the patient's arm. They dropped their fingers toward the side as they dropped their head away, which is a nerve flossing exercise, as we then tip into it and back away. The second thing they did was a nerve tension, where now they're bringing the head and fingers together and then taking them apart. Now we're tensioning both ends of the nerve as opposed to one end. And they found that by doing that, the patient improved substantially.
So the cool part about that is that we have a musculoskeletal complaint like impingement syndrome, and we're actually helping it with a nerve flossing exercise. Now the one caveat that I would make is that with impingement syndrome, we probably don't want someone with their arm up around 90 degrees, definitely if they're doing this at home. So I would probably do that nerve flossing exercise with a little bit lower flexion and abduction of the arm.
That's a great point. The other thing is that we often forget about potential neuropathies when we don't have numbness, tingling, and the classic signs. But anything that is reproduced mechanically in the extremity could have a neuropathic component as well. So one simple way to check that out, arm squeeze test in the upper extremity. If I squeeze Dr. Steele's arm and all of a sudden he says that hurts, it's probably not his bicep and tricep. It's probably not a shoulder impingement. It's probably at least a component of the cervical spine, which shouldn't be surprising. Two studies in JMPT, one by Vanderwint a couple of months ago, told us that patients who have cervical spine pain frequently have shoulder pain. And then last year, Rosedale in JMPT told us that 43.5% of all extremity complaints arise from an asymptomatic spine. If you'd like to check out all of the nerve flossing and nerve mobilization exercises, visit ChiroUp.com. You'll be able to review them in detail. We hope that you can employ this information in practice, and thanks for watching.